Welcome back to the third session of this webinar. Without delaying much, let us start this session. Today, we have with us a very special guest, and I am honored to welcome Professor Dr. Suresh Mishra on behalf of Faculty of Public Administration, School of Distance Education, University of Kerala to this national webinar. Knowing your participants would be much more interested to learn more about Professor Dr. Suresh Mishra. I will make an humble attempt to formally introduce him. Professor Mishra, an expert on consumer issues, is currently the chair professor and coordinator, Center for Consumer Studies, Indian Institute of Public Administration. Before joining IIPA in 2007, Professor Mishra was Professor of Public Administration and Entrepreneurship Development at Haryana Institute of Public Administration. He had his advanced training in corporate governance at Tokyo, Japan, in total quality management at UK Civil Service College, and in public policy management at the Development Studies Center, Israel. He participated in the public administration program for senior officers at Paris, France, and also attended advanced training of trainers program on training techniques and methodology at Thames Valley University, UK. His major areas of interest include consumer affairs, total quality management, grievance redressal, service delivery, and organizational effectiveness, administrative reforms, public policy issues, and public sector reforms. And sir will be taking over the topic on policy formulation and implementation during post-COVID era. Professor Mishra, over to you.
Friends, good evening and welcome to this session. For us in Delhi, it is getting cold. So the session normally we finish by 5:30, but you start by 6:30 and we go. So I'll be making a presentation for say an hour or so, and then we can have question answer discussions, whatever you would like to. Uh, I'll be essentially talking on policy formulation and implementation during the post-COVID era. So that's the theme that I'll be discussing. Now, friends, policy formulation is a very, very huge task. It's not that you have one, two, three, four, and that's policy formulation. Similarly, in the implementation, every change that comes in uh, as a result of certain events results into certain policy formulation and implementation. Policy is essentially a sequence of events, a sequence of decision making, sequence of activities that are brought in to uh, to uh, to really carry out a task that can be administrative task, governance task. So you have to see policy formulation and implementation in that context. Now, COVID, as we all know, is something that no governments really ever thought that it could happen like this. So essentially, you will have to see my presentation in that context. Now, if you look at the COVID-19 uh, initial stages, if you look that there was a policy paralysis. Well, governments did not know exactly how do you handle COVID because no government had ever faced this kind of problem. And the problem was not at one end, it was affecting every part of the society, every part of the country, every aspect of country, whether it is economics, it is politics, it is education, it is health, it is market, business, whatever it is. So essentially, if you look at COVID cannot be confined, as you know, to a single country because that was a global phenomena affecting everyone. So if you see that the world is facing humanity's biggest crisis since World War II, and therefore every country had been affected by the devastating corona disease. So it's not that COVID is restricted to certain countries, regions, but it's a global. Therefore, it affects large section of the policies and programs also. So essentially, we all know that the outbreak started from China, which China continues to still deny that they are the epicenters, originators. And within a few months, it shifted from China to Europe, to United States, and other countries. And as you know, it came to India in the first phase. Second phase was very, very devastating phase because the experience of first phase did not really help the country to come up with policies to essentially ensure that the second phase will be better off, because it just spread so fast that government was also taken back. Now, if you look at the volume that till date we have around 260 million people who were affected by this, and nearly 5.2 million people have died worldwide. Maybe these are the cases which have been reported. Even in India, you find that there are a large number of cases because of the geographical diversity of the country. Many people did not know whether they died because of COVID or not. So this is just the ones which have been reported, but there are, I'm sure, millions where are not reported cases. Now, if you look at this is what the death and the from the health point, but if you look indirectly, billions of Indians suffered because of the impact of the COVID. In fact, all of us suffered because of the impact of the COVID in one way or the other. Those who survived have other issues and problems. They lost their business, they lost their families, they lost their livelihood. So it has affected each one in a different way. Now, what is alarming is that the numbers likely stem from the underreporting and may probably rise, alarming in the weeks ahead if we factor in asymmetric patients and rapid tests. That's as I said earlier. Therefore, as a result, the governments across the world did not have policies to cater to the pandemic. So that was one of the major. Now, if you look at the health sector, you can't have a health facility for the entire population of the country. Nobody can ever think of, or no country can build a health system that is for all. Like 100, we are how many? 130 crores. Now, do we expect the government to build hospitals where all 130 crores can be? No, there are certain projections of 4%, 5%, 2%, which can be taken into. So the pandemic brought a situation where all the policies that were in there, they just did not work because they could not cater to those things. Now, if you look at the globalization, its advantages, which we all talk that it's a globalized world, it's a global village. Globalization became one of the most problematic area which accelerated the COVID-19 pandemic. So the global world, in fact, in a way, globalized the pandemic also. So it was not contained to a few countries. So many countries took emergency measures to stop the propagation of the virus by blocking their national borders and restricting the internal movement of people. So what happened? So globalization collapsed. In fact, the whole, if you look at the literature that is available during the COVID about globalization, there were a lot of experts, thinkers who questioned the very survival of globalization, whether in a country where the global world has all collapsed, everybody has blocked each other, no movements, no trade, nothing was there between the countries. So the borders were all shut down, movement of people was stopped. So where is the impact of globalization? Now, globalization became a major hindrance because it was spreading the pandemic so fast from country to country that countries did not know how to contain this. So, therefore, the cost of moving people has risen sharply, and the flow of goods and money has become unreliable while online information exchange is more active than ever. So, you had the flow of goods and other thing that it became unreliable because borders were shut down, they were blocked, the internal trade was also stopped because of lockdowns. So, when infection rates decrease, each country will gradually resume economic activity. That is what is happening now once this. But with the global economy return to the pre crisis normal from the current, that's a big question. Even though the economic activity is reviving to some extent, but the question is, will we return to the pre-crisis normal? So, what is normal in today's world is difficult because you see the government has again put restrictions on travel from movement. Unless you have the double dose, you are not allowed to go even internally, travel within states. You have to have the test when you reach. So that is all affecting globalization and also the economy. So that's the big question, that will we return back to normal, or this is going to be the new normal that we are talking about. Now look at the world economy. It's at a severe risk, has put the world economy at a major risk, ravages the economic foundation of world trade, since trade is no more there. It's all restricted. Commentators have identified this outbreak as an outcome of hyperglobalization, starting the deglobalization. So that's the question, whether we are moving towards deglobalizing the world, where every country is thinking of itself. It is not thinking that it's a open border, it's a global village. The time and space has been reduced due to technology. So here, the big question is that because you are restricting trade, you are restricting movement, you are restricting everything. So the question is, are we hitting at the very base of globalization, where countries are shrinking their borders to ensure that the pandemic does not affect them? Yeah, so I was in the talking about the world economy at risk. So at the same time, the falling world price of crude oil has added further anxiety, and several estimates are now available on the economic loss and post-COVID-19 growth paths. Even the current Indian economy, you see, it has not taken off as it should have. It should have taken off because we are moving towards an economic crisis if things are not handled properly. So the question is, how hard the economy been hit? There are some of IMF estimates, and the economic growth of the country is not too optimistic for the year. Where the IMF itself has estimated that the global economy would grow at -3% in 2020, is an outcome far worse than 29 global financial crisis. Now, where the economies were going at 8 to 10 to 12%, you can imagine if it goes down to -3%, what happens? Where do the countries get money? Especially the poor third world countries, where do get the money to feed their population for the development that they are planning or initiated? How are they going to meet that? Look at the immediate cost that the country is spending during the last 2 years over the medical taking care of for the people. This was a cost that was really never thought of. So all of a sudden, you divert your resources from various other basics to ensuring that people get vaccinated. It's a huge population. We should know we cannot compare ourselves to small countries, because once the small countries can still survive, but a huge country like India with a huge population, and with a population where poverty is there very high, you have to ensure that you feed your population and keep them safe. So even economies such as the US, Japan, UK, Germany, France, the bigger ones, the stronger economies, are expected to contract this year by it's coming down by to almost 5.9, 5.2. So even the advanced economies have been hit harder, and together they are expected to grow by -6% in 20. And you can see these figures, which really are giving a very gloom picture of the economic growth that is there. Similarly, if you look, China's GDP has dropped by 36% in the first quarter of 20, while South Korea's fell by 5.5%. In Europe, the GDP of France, Italy fell by 21%, 19, and 17. Now, these are very strong economies. countries which have strong economic base, and where the production is higher. Now, what happens to a poor economy like ours when these are hit so badly because they don't have that kind of population to feed? So now, if you look at the stress that they have on the supply chain of food that we are looking at. Now, if you look at the COVID has imposed shocks on all segments of food supply chain, simultaneously affecting farm production, processing, transport, logistics, and final demand. Now, during the lockdown period, what happened to all that food that was produced? What happened to the food that was the food grains that were ready for harvest? Where did it go? Did it has finally gone into waste, because there no supply chain was there. They could not transport it. They could not sell it in the market. So that's the effect that the country has. So if you look at the food policies now that we have, the look at the food prices that currently they are all going up slowly as the economic activity is going. There's a rise in basic food staples, which was never there in the country. Now, IMF's projects a decrease in food prices by 2.6% in 20 caused by supply chain disruptions, border delays, food security concerns, region affected by COVID-19 and export restrictions. So movement of food, that has been a major crisis. In the lockdown period, while the price of cereals, food, milk products, seafood, and coffee increased, price of tea, meat, wool, and have declined because they could not be exported. Further, the decline in oil prices have put a downward pressure on the price of. In spite of there has been a global uh, decline in the oil prices. If you look at last year, oil price was much less. Uh, in the country, the oil price continued to rise, and it has increased. Now it has crossed 100 rupees more per liter. That is because government is trying to generate revenue to meet the demand of health facilities, education facilities, the production that has declined, trying to ensure that in the villages the food supply is maintained. So money has to come from somewhere. Therefore, the government, as a policy measure, has kept on increasing the oil price only to have more revenue to meet its demand. So, and due to the fall in travel, global industry activity has been affected. Now, look at the hospitality industry. It has collapsed during the COVID, and even now, as things are opening up, you have another variant of the COVID that is coming, and therefore there is more fear whether should you travel or not. So people travel only when it is necessary. Look at the hotels, the industries where the such recreational activities were there. Schools and colleges have not gone back to the same level of activity. In Delhi, the schools have again been shut down because of the new variant. Added with pollution, they say it is deadly. Therefore, the problem of tackling the crisis and the policies went on changing fast because the kind of pandemic that has gripped the country was never unseen, and then they had to change their strategies and policies every time to see that it's contained to at least to some extent. Now, it also, the pandemic introduced unexpected stress on food systems, creating many immediate challenges. Some bottlenecks remain, and the new disruptions may emerge as COVID 19 continues to spread. The new variant is now the question is latest reports, if you have read, it says that the peak of the new variant will be sometimes in February. So you can imagine that is already we are in the mid December. And if it starts picking up fast, what happens to the economy in the next 2 3 months is going to devastate. So therefore, the country is in a very precarious situation where they are trying to push the economy, trying to open the economy, but then there is also fear that, well, it may, the virus may spread and it may really affect the country much more. So they are very cautious in trying to open the economy, but they are opening slowly because if they shut down the economy for next 2 3 months, if there is a lockdown, rest assured it will be having a devastated effect. So therefore, the current policy is to slowly to try to open up the economy, but at the same time ensuring that the vaccination is done for all. If as you all know, if the large population gets vaccinated, it leads to a herd immunity where it becomes it will not be that lethal. So policymakers have also so far mostly avoided the mistakes made during the food crisis of 2007-8, and have also taken a range of other steps which have helped ensure the continued functioning of food supply chains within internally. They have all ensured through the Food Corporation of India that movements of food grains, especially food grains for the poor, from the buffer stock that is there, that continues to move, and free food grains are being supplied to the poor only to ensure that they do not go hungry. There is no doubt that there is an emerging food crisis. Uh, think of the people of laborers who work daily and earn their livelihood and buy food. If there is no work, they will have no food. So the statistics says in 2018, 820 million people worldwide were experiencing chronic hunger, and by 19, those living with acute crisis level food insecurity had increased from 113 to 135. COVID-19 could almost double this number to 265, and believe me, this is the largest impact would be in third world countries like India, where you have a huge population of poor people who cannot afford to have 2 square meals, and the government will have to ensure that they have food. So the poorest of the poor are the most vulnerable to the compounding impact of 19 on the global food system, including its effect on food production, that is planting, that's harvesting and sowing, transport, processing, and safe distribution to and from local markets. So everything, the crisis has affected the food sector to such an extent that even the markets, the mandis, all had to really be shut down. So without international collaboration, protectionist measures by national governments and disrupted supply chain could cause food shortage, increasing food prices world, and that is what we are witnessing today because of the disruption in food supply chains. Even if you look at the online food baskets that are there today, there's so much of disruptions that there is you book an order and you get it after 15 days. Sometimes they say that the shelves are all empty; they don't have because there is no regular supply chain movement is there. The crisis has added to the problem of not only health but of food crisis that the country is facing. The other problem that the policymakers face resulted into internal migration. You will see that millions of migrant laborers from all states, they just walked from their place to their home back because there was no means of. So therefore, if you look at the migrant laborers, they contribute an estimated 10% of India's economic output and play an important role in the economy, such as Bihar and Uttar Pradesh in the north, to work in the industrial hubs of more developed states like Gujarat and Maharashtra, or in the even in Gujarat, in Kerala, you have a lot of migrant laborers who were forced to leave finally. So there were policies were needed to be put in place to protect stranded migrants, workers, and to ensure the reintegration of those who return to their home countries. Says the now lot of people who are working in the Middle East, they were also brought back because there was no work and they could not survive there. So how the government handled these things. So they were focusing on the policies. They were all coming back. So tens of millions of migrant workers forced to return home because of the pandemic after losing their jobs, and they face unemployment and poverty in their countries when they were coming. That's what the International Labor Organization or ILO warned, that all those people who are returning to their countries, uh, they will- they will not have job here, and unemployment would result in a severe poverty, where the government had to take certain steps to ensure that the labor which is returning back is taken care of. They have provided some kind of security, at least food security, which is there. Now, all of us are in the education sector, and you know how COVID has affected the education. It has affected to a large extent the education, where the even whether it is the universities, whether it is schools, colleges, whatever technical, medical, everything it has affected. It's a kind of crisis that one could never imagine, where students would just sit at home and do nothing. So most governments around the world have temporarily shut down schools in their effort. And look at the data of UNESCO, that 60% of the world's student population has been affected, with 1.19 billion learners out of schools across 150 countries. Now, the dropout rate in India was already high. Now, because of this COVID and digital divide, even though people started the online classes, but there are a lot of a huge poor population that was not did not have access to the technology like smartphone and other, and they could not. So, lot of young learners from the school, they were out of the schools. So you can imagine the uh, uh, how it has affected the education. Loss of access to education not only diminishes learning in the short term, but also increases long-term dropout rates and reduces further socioeconomic opportunities. You can imagine that children in the rural areas who don't have access to technology and they cannot attend online classes, what has happened to their future for the last 2.5 years? The social impact that it has on them, that's something one has to really. Therefore, the consequences of school closure are predicted to have a disproportionately negative impact on the most vulnerable group. Is the poor ultimately? It's the uh, people from those who do not have access to the technology and other mediums. It is they who have been largely affected. Now, few look at the number of students going abroad for their studies. Vulnerable children will have fewer opportunities to learn from home, face graver risk of exploitation, and may lack adequate food in the absence of access to free or subsidized school meals. Now, a lot of children in India, they have that midday meal, especially the poor children. They in the schools, the government runs that midday meal scheme. Now, those students who were getting free or subsidized school meals, that was the only way that they could have the required nutrition, and many of them would otherwise not get even their full stomach full meals. Now, they have really been put into a great trouble because of the not having able to sustain themselves at so the responsive education system to COVID need to keep cultural and contextual factors, including gender. It is the girl child which has really suffered because of the COVID, because they could not being at home in the vulnerable sections of the society. where it is still felt that girls should not, education is not meant for them. Girls should do their housework, and that is why they were forced to work and not study. So, geographical differences in order to ensure the vulnerable groups have access. Now, if you look at the international students and their families, will be reluctant to go or send their children abroad given the uncertainty of the future of the second wave or next outbreak of the virus. So, study portal, the Dutch based global study choice platform, released a survey of potential students abroad since the group. Even in India, there's a huge population of students that would go abroad, but you see the enrollment in the foreign universities has reduced substantially, and those students who were supposed to get admission, they have paid their fees, they could not also go. So to cater to take care of the country during the COVID, the government, had came up with the strong acts which were already there but never used. The whole situation to control the pandemic came under they used the Epidemic Act of 1897, Disaster Management Act of 2005. Now, Disaster Management Act of 2000, essentially for almost a year or so, there was a collapse in the federal structure of the country. Now, in Kerala, even in a small town, whether we should have lockdown or not was being decided by the central government under the Disaster Management Act. So it almost became a unitary system of governance that was there. The federal structure was not there because state governments did not have a say. Central government would issue the notification and the states would have to implement. So you have to also see that how the Central Disaster Management Act really ensured that the states would not have much powers during the crisis. So you also had the Indian Penal Code, National Security Act, and the Information Technology 2000. You know that WhatsApp became one of the major the sources of misinformation and fake news, and therefore the Information Technology was used for 2000. A National Security Act was used against those who were disrupting the medical examinations and other things. So these were the government had never invoked these legislations to such a large extent, and therefore, as a policy, they came up with these things.
Thank you so much, everyone, for being such a wonderful audience. And let's go for a short break. Stay tuned for the next part.